Hi guys, thanks for joining. Did you ever think which jobs are associated with the highest risk of exposure to a COVID-19 infection? Doctors? Yes. Nurses? Yes. But did you ever think that you may put at risk your hairdresser or anybody in the so-called beauty business? Well, take a look at my presentation. Most data which I will be showing today are based on these two articles from The Lancet from June 2020, as well as on the recommendations of the World Health Organization and the CDC. The highest concentration of the viruses which cause COVID-19 is in the nose and in the mouth, what means that it will be transferred from person to person mainly when coughing, sneezing, or talking. And we can ask ourselves the question, how far can the droplets travel from person to person when we cough, sneeze, or talk? We used to think that if we keep a 2-meter distance, that this is sufficient to feel safe even if we have no facial protection. Well, this is not true anymore. There are new data from June 2020 which show that droplets which contain the coronavirus which is causing COVID-19, that these droplets, they can travel as far as few meters or even more, especially indoors. So the 2-meter rule remains valid, but only if we use adequate facial protection. And what means adequate facial protection? Yes, it means that we cover the nose and the mouth. Covering the mouth is not sufficient, and the recent recommendation of the World Health Organization is that this is a 3-layer mask for best protection. We have to keep in mind that a person who looks perfectly healthy may be infectious, and it is not only coughing or sneezing what is the source of infection. Just talking is sufficient to produce droplets that can infect by transferring the virus. So there are two variables which are important when defining the risk of infection when talking to a person who is COVID-19 positive. First is the distance, and second is the time, with 15 minutes being the defined time which increases significantly the risk. Now let's get back to our hairdresser. Is our hairdresser in the immediate zone of highest risk because the distance from us to the hairdresser is less than 2 meters? Yes. Do we spend more than 15 minutes with a hairdresser? Yes. So we should do our best to not put our hairdresser at risk of infection. And these are not only hairdressers who are at high risk of infection because they spend with their clients more than 15 minutes at a distance of less than 2 meters. This is any person who is having a job which requires spending time with their clients at a short distance and long time, especially if by definition the client has no facial protection. I will finish with some tips on how to protect our hairdresser, cosmetician, makeup artist, and any person whom we visit as a client, how we can protect them from the coronavirus. Well, first and probably most importantly, if we feel that we are maybe coronavirus positive, we should not visit our hairdresser. And it is important to remember that a negative test result does not make a healthy person, because there are many false negative results. Second, it is now recommended to use a 3-layer mask, and an example of that 3-layer mask is a simple surgery mask. Third, it is important to remember to cover the nose and the mouth, and the mask which is covering the mouth only is far not sufficient. Next, we have to remember that the droplets which transfer the virus, They are generated when we talk, so we should limit talking when we are face to face with somebody at close distance. And finally, if we do develop COVID-19, our hairdresser should be one of the first ones to know. If you liked this video, consider subscribing to my YouTube channel. Today I was talking about our hairdressers, but usually I talk about hair and about hair diseases. Thanks a lot. See you next time.